Hello, everybody. It's Dr. Allison, and today we're going to talk about circumcision. And this is a topic that honestly I never thought I would be discussing, especially on a Facebook Live where the entire world can see and hear this. But I think that there's so much information that we're not getting on a regular basis. And I can remember the first time I heard something about circumcision. It was in a pediatric seminar. And honestly, the information went in one ear and out the other. And I was like, okay, if I have boys and when that time comes, we'll make that decision then. But it just wasn't something that I looked into or even studied. And so now I've been a doctor for several years, and I've been around, my friends, my family members, so many people are having kids. This is our first, but many of our friends already have kids old enough to babysit our kids. But it is something that is not talked about. Like, this discussion has never come up with friends or family. And it wasn't until about a year and a half ago that one of my friends asked me, and she was having her second boy, and she said, hey, have you guys discussed the topic of circumcision? And I'm like, no, that's just kind of a no-brainer, like everyone does it, right? And she was like, no, they don't, and you do have a choice. There are risks. And then actually my first thought went to, I don't really like to use the word religious, but a religious standpoint, because I do have a background of faith, and I believe that the Bible is God's inspired word, and it is literally our game plan laid out for us every day. It's instructions, and it's so that was something. It was a misunderstanding, and we know that circumcision was in the Old Testament, and it was a part of being part of God's family and His children. So I started reading in the New Testament, literally just like going to my index and looking up circumcision. And in Acts 15, it talked about when Paul was speaking to the Pharisees and like other groups of leaders that got together, and they were discussing the issue because so many people who were not Jews, they were called Gentiles, so many people were converting to Christianity, and they were like just giving their lives and saying, hey, I want to follow the Lord and everything that He has for me. And so the issue of circumcision came up because these were all grown men. And so they had this huge meeting about it. And the conclusion of that meeting, they had decided that if there was, and I apologize if I'm botching this, dive into Acts 15 all by yourself. But so there was a large group of Gentiles that the Holy Spirit had poured Himself out on them. And so Paul brought up the subject that if the Holy Spirit saw fit to fill them with His Spirit, then I'm quite sure they're not going to be disqualified by a change in their physiology. So the long story short is, it is an Old Testament law, and with the new law, basically those leaders have decided and laid forward that there are more important things, such as where your heart is at and your integrity, than whether you have an intact penis or not. So anyways, after reading through that, it really I felt good about looking into the options. And it was just a couple weeks ago that a patient told me about a website called yourwholebaby.org. So we'll put that down in the comments. But again, it's yourwholebaby.org. What a phenomenal resource. There is information I'm going to share a little bit with you here. There's information on what is the intention of a foreskin. I personally don't believe God gave us any part of our body that wasn't necessary for some reason. It talks about the complications, talks about why we do it in this country, but maybe not other countries. There are resources there. If you're a doula, a midwife, a chiropractor, or just a mom wanting to share this information, there are pamphlets, like trifold, pretty PDF pamphlets that you can hand out to your patients with this information that has been researched. And it really is just solid. So some of the things that I had no idea was, since the late 1800s, it's been promoted in the U.S. and some other countries as medically needed. We have said, I've even heard other doctors say, oh, it prevents infection. You know, there's lots of different reasons that we do that in the U.S., but studies show that 70% of the world, the men are intact. So this raises some questions. Many people know and understand, like maybe you're a mom or dad and you're like, well, if it was important, the pediatrician would have brought this up. But unfortunately in America, because we've been doing this just as a regular procedure, a standard procedure for so long, not all pediatricians are educated on the fact that there is an option, nor are they educated in the care of the intact penis. So those resources are there for you as well, because as the physiology is changed, because the foreskin is literally cut off, there are some other things that arise that you do have to take care of differently. And it's really cool. One of these, let's see, this is, excuse me, required knowledge for pediatric physicians on smegma, ballooning, yeast, redness, irritated foreskin tip. So lots of different, lots of different things that would come with leaving your child intact. But the cool thing is most of these things are like, hey, don't worry. This is no cause for alarm. They don't need to go to the doctor. This is how you take care of it. And it goes into great detail about how to take care of the intact penis with no soap, just using water. I just want to read a few of these things. Wait, this one. These are the functions of a foreskin, which again had no idea. This was not discussed in school. It wasn't in our anatomy books. But the foreskin keeps the glands healthy, clean, moist, and sensitive. The sphincter muscle at the tip of the foreskin protects the urethra from contaminants. Pretty important. The foreskin is densely populated with nerve endings that transmit fine touch sensations. The frenulum, which attaches the foreskin to the shaft, which is often partially or even fully removed during a circumcision, is highly sensitive and a pleasurable part of the male genital. So this certainly, if you were reading this, it may be a little easier to discuss it as a female, but even reading it as a male, you're like, why on earth would we ever take a part of that sensitivity away? Because then it is, again, someday stealing from your intimacy. Let's just talk about that for a second, how much easier it is for a female to talk about this subject than a male. I have another friend where she felt like this was a really important topic. She was looking into it and reading it. And when she brought it up to her husband, he was instantly defensive. He was frustrated, irritated at the subject. It was just like, no. Because the first thing that he thought of was, that'll be so weird that my son will look different than I will. And how will I explain that? And he'll feel different. When I first brought it up to my husband, he was like, no, those kids got made fun of in the locker room. And it's like, that is so sad that is where our culture had shifted, but it is. It's like, the girls, like, we didn't all shower together, but the boys, as they do when things look different, sometimes they get made fun of. But there's just another opportunity for you as a parent or aunt or uncle, grandparent, whatever, just to instill confidence in your child, just that his body was made beautifully, wonderfully, and with an amazing intelligence, and there's no reason, no medical reason that you really should be removing a part of that. There also are risks of circumcision. So one of the risks we know is with the clotting factor. So I read a really cool book. I think it's The Maker's Diet, but I'll have to get back to you on that one. But it was basically comparing some of the ancient laws that God gave the Israelites in following, like don't eat pork and don't eat this and do this and do this. Well, all of these laws were just that. But now, as the research is uncovered, it is so cool to see how God was protecting his people. So one of the things that was really important is in the Jewish community, they did not bring a baby to be circumcised until he was 8 days old. Well, one thing that we know that happens around 8 days old is a baby's clotting factors change. So we know unfortunately, because of probably people getting sick or dying, babies dying, that the clotting factors are so important, and that's why your baby gets a vitamin K shot if he is going to receive that surgery of the removal of the foreskin. Well, you can ask for a vitamin K shot that does not have preservatives or thimerosal, but you are going to be hard pressed. They're going to give you a hard time, tell you it's not possible. It is very rare that people are able to easily get a vitamin K shot without thimerosal, which is mercury. So I hope that no one wants to put mercury in your children's bodies, but that was another reason that so many of the home birth communities and the crunchy moms and all of these other groups that we're a part of are looking more into this, because I, for one, am planning a home birth, and there's really no reason, if there's no emergency, no complications, I would like to have no reason to go to the hospital, especially for something like a circumcision. And so when I found this, it was also it was just really relieving to know that we didn't have to get a vitamin K shot with mercury and then go through this process. So we have chosen, since we're growing a little boy in here, that we're not going to circumcise. And sometimes the risks, they don't really bother people, but the number one risk factor that occurs in 100% of circumcised infants is the loss of the foreskin, which is fairly obvious. Far from being unnecessary, the foreskin contains an estimated 20,000 nerve endings designed for pleasure. It keeps the glands healthy, clean, moist, and sensitive. It protects the urethra from contaminants. Other risks of circumcision include infection of the wound, excessive blood loss, too much or too little of the foreskin removed, adhesions, skin bridges, meatal stenosis, painful and tight erections later in life, accidental amputation or mutilation of the glands, and death from hemorrhage or infection. Pretty scary when you read that part. So I hope that you got something out of today's chat. And I really want to encourage you, again, go to yourwholebaby.org, and just remember, when you're making an important decision for you, for your family, for your children, just do your research and then just stick to your guns. It might be awkward having a conversation even with your parents at Thanksgiving, when everybody's going to change the baby and they're trying to help out, and there is a little bit different cleaning process involved with an intact penis. So thanks for joining us, and next week we're going to talk about the amazing immunity properties of breast milk, and then who knows, several weeks down the line we might be discussing the difficulties with breastfeeding. But we'll see you soon. Thanks for joining us.